Hello, today I'm going to demonstrate the Innov8 Low bed. So the Innov8 Low bed is an acute medical bed that can be used on your general wards. However, it is also suitable for those patients who do require a low bed. The bed itself is a 4-section profiling bed and it has a maximum height of 71 centimetres and a minimum height of 22.5 centimetres. The bed has a safe working load of 255 kilograms, which is roughly 40 stone, and a safe patient weight of 190 kilograms, taking into account any bedding, accessories, or mattresses that you use. There is no upper or lower age range. It's very much dependent on the patient's size in proportion to the bed frame and the gaps. For those patients of a very low weight, typically less than 40 kilograms, and a BMI less than 17, but also a physical size less than 146 centimetres, a risk assessment is required to be carried out to determine suitability. The bed frame is suitable for patients up to 185 centimetres in length and 205 centimetres in length with the bed fully extended. Always refer to your user manual for any contraindications, especially when using the bed in its profiling positions, such as unstable spinal injuries. It is the responsibility of the prescriber to carry out the necessary risk assessments to ensure suitable product compatibility for the environment and also to ensure patient safety. The risk assessment should include, but is not limited to, falling out of bed, entrapment, and the use of side rails. The risk assessment should include environmental and individual hazards when the bed is in its lowest position. Always refer to your local policy and guidance on equipment selection. Prior to placing the patient on the bed, it is important to check the bed space for any obstacles that could potentially cause a trip hazard or an obstruction. Connect the power cable to a nearby socket, again ensuring it is not trailing or potentially causing an obstruction. The Innov8 Low bed is designed to be plugged into the main supply permanently. However, it does have a battery backup if the main supply is not available. The bed platform is designed to be used with a range of both dynamic and foam mattresses. Now, if you are going to use a foam mattress, the bed itself has 4 retainers, so you need to ensure that you actually place the foam mattress within these retainers. If you are going to be using a dynamic mattress that has straps on it, you need to ensure that you strap the mattress to the moving parts of the bed frame. The headboard and the footboard that you see here today are both extremely lightweight and easily removable, as you can see here. They are interchangeable, however, the footboard itself is much lower in height to allow for patient visibility and is also marked with a foot icon. There are 4 mount points at each corner of the bed, as you can see again, and they are for use with your IV poles, traction, or if you're going to be using any oxygen cylinder holders. There is also a mains cable tidy, which is located at the head of the bed. The bed functions are controlled by the patient handset and also the nurse handset that we see here. The patient handset has limited functionality within it. It has a backrest up-down button, which we can see at the top. We also have a bed height adjustment, and that goes down to the minimum height of 42 centimetres, and there is also an auto contour feature. The nurse handset has full control capability so that the clinician can lock out individual functions where necessary to reduce the risk of any accidental operation or injury to the patient. To lock out a function, firstly you need to press the lock symbol here simultaneously with any function that you want to lock out. So if we press the padlock, and the function, you can now see that an amber light will illuminate to tell us that that function is locked out. If we want to reverse that and take the lock off, again, we need to repeat the process. So press the lock and the function together, and now you can see that that amber light is extinguished. When you are locking out a function using the nurse's handset, it will actually lock out the corresponding function on the patient handset as well. The nurse handset is designed to be stored at the foot of the bed by clipping it over the end of the footboard here, which will then keep it out of reach of the bed occupant. As the bed requires mains power, the power indicator light you see here will illuminate amber when it's connected to the mains power. There is a battery backup for emergency use and during transportation, which you can see here. This light will illuminate when the bed is being powered by the battery. If the battery is low, an audible alarm will sound when you are trying to activate the handset. To activate a function, simply choose the function that you would like to use. When you press it, a green light will appear, and then you can activate either up or down until you've reached the desired position that you would like. The function will stay activated for 5 seconds. However, if it is not used, it will deactivate and the green light will disappear. The bed platform can be raised to 71 centimetres to support a neutral position when carrying out any care tasks. By raising the bed height from a lower platform, this may assist your patient to stand independently. Always leave the bed in a lower height position, which is safe for that particular patient, or in its lowest position if it has been prescribed as a low bed requirement. When lowering the bed at 42 centimetres, an audible alarm will sound. An amber LED will be activated on the nurse handset. When lowering the bed from 42 centimetres, an audible alarm will sound and the bed will lower at a much slower rate until it reaches its lowest point of 22.5 centimetres. So now we're going to discuss some of the profiling functions that are available on the nurse handset. And the first thing we're going to look at is the backrest. So I'm just going to highlight the backrest and raise. So this shows you that the backrest can achieve up to a 70-degree angle when it's fully raised. Okay. However, when you are using the backrest, you really need to be doing a risk assessment for each patient to ensure that you're using it correctly. The lower the backrest angle that you do use will help with pressure redistribution. The higher the backrest angle may assist with respiratory issues or any other clinical needs that the patient has. The second function that we're going to be looking at is the knee brake. So the knee brake can achieve up to a 35-degree angle, and it's useful in order to stop the patient from migrating down the bed as the backrest is raised. The third function that we're going to have a look at is the auto contour. So auto contour allows the backrest and the knee brake to operate simultaneously. This helps to reduce the shear and friction forces that are caused by the patient migrating down the bed. It also provides a more natural resting position and promotes comfort for your patient. So the last button function that we're going to discuss is Trendelenburg and Reverse Trendelenburg. So Reverse Trendelenburg can achieve a foot down tilt of 12 degrees. When we want to level the bed, the opposite button should be pressed in order to achieve a flat bed frame. This tilt may not be suitable for all of your patients that have certain medical conditions. Trendelenburg can achieve a head down tilt of 12 degrees. However, this should only be used with medical supervision and be prescribed. The cardiac chair position can be achieved by pressing the auto contour and the foot down tilt. These buttons should be pressed within 5 seconds of one another in order to achieve the chair position. The bed can be extended by up to 20 centimetres to accommodate your taller patients. So if you are going to use this facility, there are 2 plungers located on either side of the bed. You can see the black plunger here. It is spring loaded, so you do need to ensure that once you pull it out, it does stay out and doesn't spring back in. Once you've done that, you can then manually adjust the length of the bed, and then you can also bring out your mattress support here. If you no longer require the bed extension, you simply reverse the process and push the footboard forward. If you are going to use the bed extension, it's important that you bring your patient's mattress down to the bottom of the bed and place your infill at the top of the bed. This is to ensure that your patient's heels have pressure redistribution at all times. The bed also has a manual calf lift that can be raised if lower limb elevation is prescribed. And in order to do this, we firstly need to raise the knee break to its maximum height. So once this is achieved, we can manually raise the bed frame here, and using the calf lift bar, just slot into the channel and lower down slowly. Once this is no longer required, you simply just reverse the process. The bed has both manual CPR and an electric CPR. If you're going to be using the manual CPR, as you can see, you have a lever here, which is duplicated on the other side of the bed. Using the manual CPR will just flatten the backrest only. If you're going to be using the electric CPR, this will flatten all 4 profiling sections of the bed, as well as lowering the bed down. The CPR will still remain usable whilst the bed is in battery backup. The bed comes with an option of 2 different side rails. Here we have the 3-bar cantilever side rail, and there is also a 4-bar option as well. And this is really dependent on the needs of the patient. So in order to operate the side rails, you simply just pull out the red button here to release and lower down gently. In order to raise the side rail, again, we just pull out the button and raise until you hear the click. When transporting the bed, the headboard and the footboard must be used for pushing the bed. It is always advisable to ensure that the bed height is suitable for yourself. Remove all obstacles from around the bed space and unplug the mains cable from the wall, ensuring that you place it in the cable tidy at the head of the bed. When moving the bed, it is advisable that you use the steer function in order to track and push the bed from the bottom end. And finally, the cleaning of the bed. Each section is easy to remove to provide access to all areas. Please refer to your user manual for full details.